Okay, we had Barrett's esophagus, which is a condition where the flat pink lining of the esophagus becomes damaged by acid reflux. This also causes the lining to become thicker and red. Changes that occur at the cellular level include the lining of the esophagus to heal abnormally, which causes the cells that had looked like skin cells to change to look like intestinal cells. The squamous cells that line the lower esophagus also changed to columnar epithelial cells, which is also metaplasia. At the tissue and organ level, changes that occur include inflammation or swelling of the esophageal lining, and then different levels of dysplasia, which can be displayed. And at the whole body, changes that occur include chest pain, a chronic cough, laryngitis, nausea, or a burning sensation behind the rib cage and the back of the throat. And the first picture is like an example of a comparison of what a normal esophagus looks like compared to Barrett's esophagus. And then just another comparison from a side view going into the stomach and acid reflux going back into the esophagus. And then pictures of what the different dysplasias look like and then the resulting adenocarcinoma, which could occur depending on how bad it gets.
Okay, so some of the symptoms are frequent heartburn or regurgitation of the stomach contents. Difficulty swallowing sometimes includes chest pain, sensation of food getting stuck in your esophagus, sore throat or a sour taste in your mouth, or unintentional weight loss. The risk factors that come along with this are obesity, being over the age of 50, a current or past smoker. White males are more prone to get this disease, a family history of Barrett's esophagus or esophageal cancer, heartburn symptoms for over 10 years, or gastroesophageal reflux disease.
Is this recording? Okay. So some treatments for Barrett's esophagus is an endoscopic resection, which removes all the damaged cells using an endoscope to aid in the exposure of dysplasia and cancer. Radiofrequency ablation removes the abnormal esophagus tissue by using heat, and it's recommended usually after an endoscopic resection. Cryotherapy is the application of cold liquid or gas to the abnormal cells using an endoscope. Then the cells are allowed to warm up or thaw and then are frozen again. This causes damage to the abnormal cells. And then you can also have surgery or an esophagectomy. It removes all or part of the esophagus. So for the treatments for having no dysplasia, is usually periodic endoscopy to monitor the cells. Usually you have a follow-up endoscopy in a year, and then after that, if there's no changes, you have one every 3 to 5 years. Or you can start treatments for GERD. This includes medications or lifestyle changes, or surgery to correct a hiatal hernia or tighten the lower esophageal sphincter. Treatments for low-grade dysplasia include an endoscopic resection, radiofrequency ablation, or cryotherapy. And then treatments for high-grade dysplasia include an endoscopic resection, radiofrequency ablation, cryotherapy, or GERD surgery, which involves removing the damaged section of your esophagus and attaching it to the remaining parts of your stomach.
And then looking at these pictures, the first one is what the process of the endoscopic resection. And then right under that, we have the cryotherapy with the cold going being thawed, or the esophagus being frozen. And then we have the radiofrequency ablation with the heat going in and burning away the cells.
Some typical dietary recommendations would to be eat a variety of foods and to maintain a healthy weight. Also, to have a diet that contains foods that are low in fat, saturated fat, and cholesterol. Eat plenty of fruits, vegetables, and whole grain products with your diet. Only use sugars in moderation, and only use sodium and salt in moderation. Um, Barrett's esophagus diet would be to limit or avoid sugary foods and limit or avoid refined carbohydrates. Also, eat plenty of foods that contain fiber and limit or avoid foods that are fried, spicy, or fatty. Also, maintain a healthy weight and limit and avoid eating excess amount of red meat. Comparison to a healthy diet. So if you have Barrett's esophagus diet, you should eat for breakfast oatmeal with fruits, for lunch salad with vegetables, and dinner grilled salmon. For an unhealthy diet would be breakfast sugary cereals, lunch burger and fries, and dinner hot chicken wings.
Other factors to consider are avoid eating late at night. Also avoid eating 3 large meals instead eat smaller, more frequent meals. Smoking could cause progression of this disease. Spicy food makes it worse, and laying down less than 4 hours after eating may aggravate Barrett's esophagus. And these are our works cited.